Unplanned pregnancies cost the Canadian healthcare system more than $320 million a year. It's one of the reasons why Dr. Rupinder Toor out of Calgary wants to see Ottawa make birth control free. She is a recipient of the Cummings School of Medicine at the University of Calgary Alumni of Distinction. She's received the Recognition of Excellence from the Canadian College of Family Physicians. She's won the Legacy Award from the Calgary Board of Education. She's a recipient of the Queen Elizabeth II Diamond Jubilee Medal. She's been named a Woman of Vision with Global Calgary, an Immigrant of Distinction, the Sharon Carey Community Leadership Award from Bow Valley College, and from the India-Canada Association of Calgary, an Outstanding Service Award. Dr. Rupinder Toor out of Calgary. It's asking the federal government to make birth control free in Canada. And I've been privy to some really interesting conversations, and obviously it's not just a women's health issue, but why don't we talk about how this has been viewed or how this has been treated in Canada through the decades?
Historically, because, obviously women are the ones that actually bear the reproduction. It seems like, a lot of that responsibility has fallen on their shoulders. But I think, we've evolved as a society to really realize that, there are actually, two partners involved, and we need everyone involved. I think reproduction is something that doesn't just affect women. It affects individuals, it affects families, it affects society. So I think it's not a women's issue. It's not necessarily a men's issue alone. It's not a youth issue alone. It's a human issue because it affects all of us. Unintended pregnancies cost Canadian taxpayers $320 million a year. And that's just direct healthcare costs. That's not including any kind of social subsidies for people who are having pregnancies when they're not intending them, but now they need support of, society to help sort of to raise that child.
What would it cost, so to speak, to eliminate cost barriers for birth control?
The great thing about this policy is that it has been shown, studies have shown this time and time again, BC passed this based on the same data, is that every dollar that we invest in universal contraception can save the system up to $9 in the public sector. It really does save money. So economically, it is a sound policy, right? So if we're just going to look at it from that perspective, it really does make sense. Access to birth control that was equitable and secure, can really help to strengthen individuals and families and societies, right? So there's a huge social benefit. When I see, a young woman who's facing an unplanned pregnancy and her life is now going to be significantly changed, how do we measure the cost of her untapped potential? Like her life now has significant, maybe now her access to education, her access to economic security is going to be, compromised. Maybe, living the life that she wants, her happiness factor is going to be compromised, right? So I think, there's that social sort of benefit. Why are we pushing this at a federal level? And it's simply that reproductive rights are human rights, and they cannot be left to the whim of changing provincial government. So every 4 years, depending on what ideology of the government that gets in, that human right is going to be up for negotiation. And that doesn't seem right or fair. And so I think as women and as men who love women, and as, people who see where the strength in our society is going to come when all members of our society are doing well, that we really need to have this at a federal level because it needs to be protected at a federal level. All we need to do is just look south of the border, and we see that today in real time, these rights are being access to, reproductive care is being restricted in the US. They are making policies to make that more and more difficult. This is an extremely popular policy. There was a study that came out that showed that 83% of Canadians approve of free prescription birth control across the country, and 7 in 10 feel it's an urgent issue. I mean, we only have until August 25th. I want to get back to the petition because I want to make sure your listeners know where to go to get that. So I just want to talk about the fact that, it's a 30-day campaign. It ends on August 25th. Any, woman can sign, obviously, any Canadian resident or citizen can sign this petition. So, we, of course, we talk about it being a women's health issue. Most women, we don't have to talk about too much. They said, yes, I agree with this. And if we're not doing it for ourselves, we're doing it for our daughters. We're doing it for our granddaughters. We talk about, historically where we've been, and we talk about our ancestors, but sometimes you think about our descendants and what would they have wanted us to do given the context of everything that's happening in the world today. So obviously women can sign. And we talked about men, I think, again, have been, have not been brought into this conversation. When I do work at my clinic, we often would do information sessions on, longer acting forms of contraception. And we would would do group sessions. And oftentimes our patients would bring in, their male counterparts, either their partners, their husbands, even their fathers. And I used to love having men in the audience because they were so interested in this, because they didn't know anything about birth control and how it worked. And they were fascinated. They're like, oh my God, they would ask all the questions. And so I loved it when I had a man in the audience, because I knew he was going to ask all the right questions, because he was so interested in this and he had never been invited into the conversation. So we would invite all men to go and sign this, to sign this petition, not necessarily because it affects you directly, but it affects people that you love, right? So whether it's your partners, whether it's your daughters, like whether it's, your sisters, whoever it is, right? They're going to benefit from it.